Thank you so much for inviting me, and I hope this is on. So I have to correct something that you said, Dr. Lish. You do know something about narratology. If you are a human being, you do your work in stories. You know what you know by virtue of telling about it, hearing about it, and gathering within clearings, if you will, where stories are told and heard. My family from long ago is from French Canada, and I never lived in Quebec, but I've heard tell of it, and that's how I know as well as I can from whence I came. So that all of the ways, it's the first day of Seder today, or Passover, so that the way in which many New Yorkers and human beings will gather round tables tonight and tomorrow night and through this time to tell and retell the story of slavery, the story of freedom. Those of us who grew up, as I did, Catholic, have been at Seder tables hearing the stories of slavery and freedom, so that these things not only unite pockets of individuals, but unite us across boundaries. These things happen in our august medical centers. I know that many here in this Schwartz building are dentists, dental educators. A few are nurses. There may be other professions represented. But the hope that you spoke of in welcoming us is indeed that we share those concerns of ours, the deep concerns that may be anterior to or prior to our separating into dentists, physicians, nurses, social workers, or public health professionals. I'm gonna ask a rather audacious question, which has been for some time now my initially plaintive but now rather militant question, and that is, what is healthcare for? What is healthcare for? We feel that, and we act as if we know what it is. Certainly within each our little sector. I'm a general internist. I practice in Washington Heights. I take care of grown-ups with that rare triad of hypertension, diabetes, and osteoarthritis. So I mean, that's what I do. But what is the healthcare for? And I think we don't have much liberty to ask such fundamental questions. At its purest, healthcare is what might, should, or might, could happen in a clearing around a singular person who seeks help. What is it we might want to ask ourselves as we enter that clearing around that person? What is it that that person might do or have so as to improve his or her health? We don't need to, at this level of asking questions, specify what health means or even what it's restricted to. But we need to wonder in very racy ways what health and health care might be. So that if you're gathered around, say, a child with a cleft palate and cleft lip, you know who you need in that clearing. You need the pediatric dentist, you need the ENT surgeon, you need the anesthesiologist, you need plastics, you need social work, you need nutrition, you need speech therapy. All of those persons need to be in that clearing around the kid with cleft palate and his or her family. We hosted Malcolm Cox not long ago as our visiting professor He is the Chief of Education and Affiliation for the VA, nationwide. He's in charge of the training in the VA, and he's in charge of the VA hospitals as they give care. And he said over and over again, I had him coming to 10 different groups, and he gave lots of different presentations while he was there. he says, we don't provide the veterans with health care. We provide them with health. And so, within that definition, we made sure to have the Columbia University Veteran Affairs team with us, because they have nothing to do with health care. They provide tuition, career counseling, marital counseling, meditation, re-entry for vets coming back from duty. So in Malcolm Cox's mind and in the mind of the VA, that constitutes health. And any kind of health care in, you know, diabetes or hypertension or psychosis or depression or PTSD complements this attention to what we might consider health. Now, what we don't know, have I lost you already? What we don't know is what people come to us looking for. And I admit that as an internist, I don't expect persons to come to me looking for tuition exemption. But we have to ask ourselves, before we constitute ourselves as teachers of the healers or teachers of the clinicians, what do people come to us looking for? I think this is a question whose answer has changed over time, radically. I think this was answered in a different way when there were other forms of help, when persons had spiritual advisors or confessors or librarians or grade school teachers who knew them from K through 12, or all of these things. There may have been a different emphasis on what they now come to the doctor or the nurse or the social worker or the dentist for. We assume they come for relief from symptoms or treatment for disease or protection from disease or redress from pain or reassurance or help with some duty toward the body. And we also know, in however specialized a segment you find yourself, we also know that they come because they're mortal. That they come seeking health care in the glare of the knowledge that they age, and as they age, they come closer to the end of their life, and they do their best to perfect it, to let it go on happily as long as it can. I want to read you from a paragraph from a novel called Infinities by John Banville, who is an Irish writer, Dublin. I think he's among the 4 or 5 best novelists writing today, in English anyway. He's writing in this novel, the speaker here is Zeus, the head of the gods. Zeus is up on Mount Olympus with his buddy gods. And they're looking down at the hapless mortals that they've created. That would be us. And Zeus says to his colleagues that he envies us, our mortality. And this is why. This is Zeus looking down at us. This is the mortal world. It is a world where nothing is lost, where all is accounted for, while yet the mystery of things is preserved. A world where they may live, however briefly, however tenuously, in the failing evenings of the self, solitary and at the same time together, somehow here in this place, dying as they may be, and yet fixed forever in a luminous, unending instant. That's us. Solitary and yet together. In the failing, it's always failing, evenings of the self, and yet in this luminous instant. So this is what we see in the office, whatever your office is, as those who seek health care come to us. It is for sure because there's an ache somewhere or a pain somewhere or bleeding or crooked teeth that need to be straightened. And this is toward the luminous instant in which one knows self, one knows other, and one can do work. So that's not to be, you know, highfalutin about it. It's very, very day in, day out. I see a patient not long ago. She had had breast cancer. She was treated. She had a lumpectomy. She got tamoxifen. She got better. We told her she was cured. And then she gets a second tumor in the same breast. It's a new cancer. She needs this time a mastectomy. And she goes through it rather uncomplainingly, stopping what she was doing, submitting to the extensive now surgery. And she does well. And she says, no, I don't need reconstruction. I'm too old for that. She does fine. But then she's stricken with the fear that it's going to come back a third time. And she keeps feeling in the mastectomy scar bumps and lumps and irregularities, and she's terrified. She goes to the breast surgeon or me like every other week. And we're doing cancer markers, and I'm ultrasounding the mastectomy scar and like going out of my way, and I confer with the breast surgeon. And we keep telling her, you know, that's how the tissue heals. There's shifts, there's changes. Of course it's going to feel different from week to week, but she is, as they say about crying children in the ER, inconsolable. And she thinks, she can't be reassured, and so she thinks that we're deceiving her. And so finally, after still another one of these breast exams, when everything seemed fine to me, and I even touch the scar and I call it beautiful because it was beautifully healed. I'm leaning against the sink in the examining room, and it just strikes me. I say, I think I know what's happening. I think because you're very aware of what you're going through, because you're really smart, because you're not afraid, I think you've become aware that you will die. I said, I can't tell you what it's going to be. It might be breast cancer. It might not. There's probably something within you that will cause you to die. And I said, I can't do anything about that, except for one thing that I can think of. I can join you in the glare of the knowledge that you will die. And when I called her a few days afterward, just to check in, to tell her how moved I was by our conversation, she said she felt much better since then. She was sure I was right, or that we were right in what we said. The visits stopped to me and the CA 27, 29 levels and the breast surgeon. And this was by now over a year ago. I wrote about this because that's how I learn what's happening. I write about it, and then I show it to the person it's about. So I did a house visit with her because I wanted her to see exactly what I had written about that day. Had her read it. She made some corrections, the timing, this and that. But it was all the more palpable, real to her, that we had had this conversation, that we together were in the glare of Banville's mortality, and that at very least she wasn't alone in it. I've seen her several times since then, and she really has, how can I say, recovered from the fright, the irrational fright that this cancer would come back a third time. So I give that as an example, not so much about how to take care of breast cancer, but rather how the telling and the receiving and the recognizing and the configuring of these things that happen within our sight can help. Now, the reason I was so excited about being invited to join you here is, as a teaching academy that perhaps exists within one of the schools, but at least welcomes persons from other schools and other disciplines, we're engaged together in what's feeling like a very urgent effort to widen these clearings that I talked about. At Columbia, we got a fair amount of money from the Macy Foundation to really structure and move ahead interprofessional education for the students and for the faculty. And we were happy enough, or smart enough, to start with the faculty. So with the first year of funding, I was very selective. I took 2 faculty from the nursing school, the dental school, the School of Public Health, and the medical school. 2. I spent the entire budget on 8 people. They were associate deans, they were senior vice deans, they were heads of curriculum, they were deans of student affairs, because the history of interprofessional colleagueship at Columbia is rather grim. It's not enough to say we're in our silos. We loathe one another. We fight for classroom space, status, money, indirect cost on the NIH grants. We fight for this, the dorms, the who gets the amphitheater for commencement. We have this horrible governing structure where there are 4 deans, but 3 of the deans report to the 4th dean, and that dean reports to the president. This is very bad. And so it was not a surprise to anybody that I took a whole year of spending my Macy money to gather these influential, top-down, top faculty, many of whom had tried and failed to bring the schools or the students together. Now, at other schools, there's more. Do you have such things here where you try to get the students together from the different schools? Have you started that? So this is a growing movement. There are more and more. I'm pretty sure the dental licensing requirements have now, or will have soon, a requirement for team building or healthcare team development. We certainly have it in the medical schools. In the nursing schools, it's there already. There are consortia, there are competences, there are checklists. And all of us know that if not now, then when the Affordable Care Act comes and the patient-centered medical homes come and the accountable care organizations come, that we will not be able to survive without really adequate, respectful, trusting, effective, nimble healthcare teams. Now, at other schools, what the Macy money gets spent for is, like, they get the students from the 4 different schools together, hundreds of them. They make them do something that requires teamwork, and it's usually simulated, right? Okay, let's make believe here, this man here in the purple sweater is a patient coming into the emergency room and he complains of chest pain. What do we do? And you get a nurse and a doctor and a pharmacist, for example, and you go do what needs to be done for the fellow with chest pain. Or it's a cardiac arrest, and who's going to name the medicines, and does the pharmacist know more about the pharmacodynamics than anyone else? Or they talk about error disclosure, which is a dicier one. but still in a simulated with an actor playing a patient. These are usually one-time only things, and they get 600 kids together and they kind of have them have these experiences, and they may or may not, you know, keep anything from that one-off experience. But the thing is that these kinds of exercises puts the students squarely into the roles. So the pharmacist has to figure out what is the pharmacist's role here, and the nurse has to figure out what is the nurse's role at the cardiac arrest. And the medical student has to figure out what am I supposed to do as the proto-doctor here. And if we think that the trouble is the roles themselves, then it doesn't help very much to insert them into the restrictive roles. The public health professionals are usually like out in the breeze. Do you have a public health school? Do you have a public health school? And you have a policy school too, right? Mm-hmm. The wagons. So they're usually way out of the picture because they don't do one-on-one clinical work, or so they think. But certainly when the public health professional is doing an ethnographic survey and is interviewing subjects at great detail, they're doing clinical work. They just don't call it that. So our goal was to gather persons, but not to do these clinical things or simulations that would restrict them into their role, but rather to expand. And so I'm the one who was the PI on the Macy grant because they came to us and said, we think some of these narrative methods might really help. And we want you to put those to work in developing team, in answering questions ultimately like what is healthcare for. So with my 8 faculty, we gathered 2 and 3 times a month for 2 hours at a time. And we did narrative work. We read together. We wrote together. We watched movies together. We listened as one another told stories. We interviewed one another. We invited persons to come in and for interviews. And then only after that year were we able to then engage students in the same kind of work. Now, the reason that these 2 worlds of mine combine, they're not antagonistic at all, medicine and literature, because, don't holler at me for saying this, the care of the sick is an art form. The care of the sick requires imagination, curiosity, creativity. It is never, ever the same twice. If it is, there's something wrong with it. The creative parts, the imaginative parts, the curiosity-driven parts of what we do with patients is that which leads to recognition. Recognition is a big word in my vocabulary. It is recognition of the patient for sure, and we have come to know as we do work that's well going, that as we recognize the patient, we are then recognized by the patient. You know what I mean. You know what I mean. It's a way to use all the resources of this singular person, the clinician, the one who has been come to for help, uses all the resources of that singular person to care for all the dimensions of that singular patient. So that when we live in New York. You know, did I see any of you at Carnegie Hall on Friday? Jeremy Denk was playing Beethoven. Maybe, maybe not. We live in New York. We live surrounded by beauty and by creativity. And we ourselves are summoned by creative acts of others to also, I would hope, appreciate, but maybe even express some of our own creativity. So those were the foundational ideas that we've built our interprofessional work on. That rather than meet with a nurse and a dentist and a public health professional on the grounds of What do we do with the drug-abusing sickle cell patient who comes to every ER within a 50-mile radius? Instead of asking that question, we go underneath the distinctions among us to ask questions about pain and suffering, to ask questions about simply the lived experience in these luminous, unending instants, in the failing evenings of the self. That this is what unites us, not so much our machines and medicines, but rather that we too are mortal, we too will die, we too all need the capacity to recognize and absorb and respond to, and at least receive, the accounts given by those who come to us seeking help. Now, I could go on and tell you more about what this amounts to, but I thought that I would, instead of telling you about it, give you a chance to do it. So we're going to give you some paper. Here, why don't somebody start at the other end too, so that, there we go. So I'm giving you a text. I'm giving you a text. There we go. And we're going to read it. This is a story. This is a text. This is a group of words written by someone who knows very well what it means to be sick. And simply by, you know what, I didn't keep one for myself. Thank you. Simply by looking at this is a singular person. The writer of this text is a woman. She's now dead. She died from the disease she describes. She happens to be a very good writer, so she's able to bring to our view something rather simple and clear about the situation of being ill. It's almost gone. I hope I brought enough. Did I bring enough?
I think so.
It's very short. If not, you can look on one another's. Now, do I have a pen?
Does anybody else need one? Over here.
What time is it? Oh, good. Okay, yes? There we go. Now, do you have a pen? Does everyone have something to write with? We've learned in teaching undergraduate students that they typically don't. A pen? She wants me to use a pen? So as we read this, I'll ask one of you to read it aloud. As we read it, please read it with a pen, which is to say, just keep track of the words or the phrases that interest you. All right? Somebody read it aloud.
The sick wife stayed in the car while he bought a few groceries. Not yet 50, she had learned what it's like not to be able to button a button. It was the middle of the day, and so only mothers with small children or retired couples stepped through the muddy parking lot. Dry cleaning swung and gleamed on hangers in the cars of the prosperous. How easily they moved with such freedom, even the old and relatively infirm. The windows began to steam up. The cars on either side of her pulled away so briskly that it made her sick at heart.
So that's very short. I don't know, what's that? 100 words maybe. Jane Kenyon, a contemporary American poet, lived in New Hampshire, married to Donald Hall, who's an equally well-known poet. Both of them became ill with cancer. He had bad colon cancer and recovered, was cured. She took care of him through his cancer. She then gets acute leukemia and dies after a bone marrow transplant, who knows how long, at Dartmouth. And she succumbed. And so as she had written about him, he has written about her. And here she's writing about herself, but in the third person. It's Jane Kenyon, all right, who's the sick wife, writing about herself as the sick wife, huh? So, and as you see at the bottom, this was published after her death. Now, I just told you far more than is given in the poem. And yet, just somebody just tell me what words or phrases you noticed as we were reading this.
Freedom.
Ah, yes. Why? Tell us about it.
It's been taken away from her.
Exactly. She's cooped up, but what has taken away her freedom?
The sickness.
Mm-hmm. Mm-hmm. And she's yearning for simple things, just the ease of motion. Yes, thank you. What did you put rectangle around?
The whole last stanza.
The whole last stanza. Tell us why.
The fact that she's being left alone.
Okay, exactly. So the others have the freedom to pull away. It made her sick at heart, mal au cœur, right?
She feels abandoned.
That's right. Mm-hmm. Where's the he?
That's her breath. Escaping.
Yeah, no, there's a he in the second line.
Oh,
There's a he.
that's her husband.
He's out there shopping. Somebody, maybe the husband, shopping, but it doesn't matter in that last stanza, does it?
No.
And we all know, from the poem itself, as well as what I told you about it, that all is pulling away. It's not just the cars, it's her life is pulling away. And indeed, she feels abandoned. What are some of the rectangles here?
She's learned vulnerability.
Where do you see that?
She doesn't know, she's learned what it's like to not be able to button the button.
No, as you read that, you almost change it in your mind to she learned how to button a button, like one would say about a 3-year-old or a 4-year-old. She's learned how to button a button. And what does it mean to learn how not to?
That her world is narrowing, she's reversing to
Yes.
a more dependent
Yes.
place.
Yes. It's probably, you know, a lot of these chemotherapy agents lead to peripheral neuropathies. So she can't feel the button. She can't feel the buttonhole. Who knew that a thing like buttoning a button could matter, right? And so, if that, what else? I think is the impact there. Another one or two. What are some rectangles here?
I think I can expand on the last comment that learning what it's like not to be able to do something.
Yeah.
Outside of sickness, if you're any kind of an athlete,
Yes.
if you live long enough, things you were able to do
Yes.
that was second nature,
Mm-hmm.
probably you won't be able to do
Yes.
at some point.
Mm-hmm.
And I can tell you from a personal point of view,
Mhm.
it's not a happy feeling.
Yes.
And it's something that you have to come to terms with.
Yes.
And figure out how you're going to keep being happy and going forward.
Yes.
Not being able to do something that you used to be able to do very easily.
Yes. The failing evenings of the self. Yes. And so indeed, and that's a very important door to open up here, that this is not just about people with intractable, horrible, untreatable leukemias. Guys, here we are. And even the chronic, you know, osteoarthritis, bunions, you know, the kind of things that limit and take away the swinging and the gleaming. When she says the cars of the prosperous, what does that make you think? Wealthy neighborhood, but what are they prosperous? I don't know. I think they're prosperous of living. I mean, who ever heard of a poetic use of dry cleaning on a hanger? This is a first for me. But even that becomes a kind of image of freedom, doesn't it?
The other line, so only mothers with small children or retired couples, sort of is the beginning and the end.
Ah, nice. Yes. That's right.
Yeah.
Mm-hmm. Mm-hmm. Now, you see how we could go on, kind of expanding, noticing in the words, in the phrases, in the sound, what she may be conveying. We have learned that to teach, we just did a close reading of this poem. The kind of reading where every word counts, where you expand what a word or a phrase may be doing, where you fully indulge in your own associations as you did with the things as an athlete that you can no longer do. The close reading is practice for close listening. It's practice for close listening. All of us ascribe to attentive listening, communication skills, humanistic practice as one of the hallmarks of effective professional work. And we have found in our narrative work that close reading, and you'll see in a minute, writing, prepares you, teaches you how to listen more powerfully and comprehensively to what patients tell you, or colleagues, or students. You're able to extract the evidence from the words spoken, the better you're able to train yourself to pay attention to the words to begin with. So when I'm leaning on the sink with my lady with the breast cancer, there were ways in which I think I was able to extract from what she told me some clues that led to, I think, a useful response. Now, this is the kind of thing that we did with the Macy group, with the faculty, and now we do with students. We're up to 64 students in 4 different seminars using some 15 or so faculty. But I'm going to invite you now to write in response to a prompt. I'm going to give you a writing prompt. I'm going to invite you to write. I'm going to give you 3 minutes to write. And at the close of that, I'll again invite you simply to read to the person sitting next to you what you've written. You don't have to do this. It's not on the test. But it turns out that except for professional writers, except for the students who go get their Master of Fine Arts in fiction, that many of us, especially those with science and math backgrounds and not humanities backgrounds, don't really believe that writing need not be simply reporting, but that writing can be discovery. And when we do this kind of writing in the shadow, if you will, of a text, we see that we often surprise ourselves. I never listen to me, I don't like to have students or anyone write in journals or diaries. I hate diaries because they tend to be read by no one. And we have observed that the writer is the last one who's able to understand or see or recognize what was written. And that the writer requires a reader or a listener in order to start to see what he or she has done, right? So I'm going to give you a prompt. I'll give us 3 minutes, at the close of which, if you like, read to the person next to you and let that person read to you, and we'll just see what happens. Okay? And here's the prompt. write the next stanza. Continue. Write the next stanza. Okay. So before you pair up, just let me. Was that hard to do? Huh?
Easier than I thought.
It was easier than you thought. Something came to you.
Yeah, I'm not a natural writer, and writing is difficult, but
Okay.
Yeah, it was easier than I thought.
Okay. And for those that it was hard for, was it hard to begin, to decide, to reject? You just didn't know where to start?
Well, I wanted to change the situation.
Did you hear that? Yes. Okay. All right, good. Good. The power of the writer. Was it hard?
No, I didn't think so.
You didn't think so? There were many places to come in?
Yeah, I thought so.
Okay. Okay. Yes.
I think it was just hard to follow that. And how, it's such a nice poem.
Oh, yeah.
How can I follow this?
Oh, yeah. Oh, we're not proud. We're not proud. Okay. Go on ahead. Pair up. Make yourself into little dyads and read to one another. Are you interested in reading? Oh, you did already? Oh, good. You have to read to somebody because...
Oh, we did it. We
good.
exchanged it. Yeah.
Oh, good. 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 You read. Good. Did you have anyone to read with?
Thank you so much.
Thank you.
Years ago, I heard you speak about a course that you were doing at Columbia. After the students examined the patient, you had them write a short story about the patient. I was fascinated.
Oh, yeah, yeah, and they're all very different. Yeah, yeah, yeah. Now, did everyone get to read to someone and hear someone? Okay, I know we have to finish up. Now, did you have enough time? Did everybody get to read to someone? Okay. Now, what struck me in being here with you was the laughter in the room. That this was not morose. Did you notice? In this corner there was lots of giggling. There was giggling. And I also noticed and didn't know what to make of that as I eyed you, it looked like you ended up in gender homophilous pairs. Did you notice? It was men with men and ladies with ladies. Not necessarily. You were one of the few, and there was maybe one here. But so, can you tell us? There was this marvelous warmth here coming from this group, and I wonder if you could explain that to us.
We're nursing education master's students.
Uh-huh.
And Katie and I laughed because we pretty much summed it up the same way.
You
We're wondering
did.
if it's like nursing thinking or,
Right. Could you tell us what you wrote?
well, no judging, right?
Right.
She saw him returning to the car, relieved to have at least one known experience returned, a constant in her fading world.
Yes.
And
Yes.
it's like the other lady said, I think we wanted to take her out of her misery. Or
Yes.
something, a nursing thing, like a comfort.
Uh,
So the comfort was that
yes.
husband
Yes.
was coming back.
But look at how what you wrote echoes and magnifies the poem. That using the word fading, where all of this, the the loss of freedom, the old and infirm, the steaming up, the pulled away is a fading, and you're trying to bring it back. Now, is that just a nursing thing? No. You don't have a corner on that. And as you listened to her, the harder part I find in doing this work is not the reading aloud, but the listening to the other. What was that? How did that work in your pair? Was it harder to do the reading aloud or the listening?
Go ahead. We were pretty good. We didn't have any concerns at all. In fact, we shared a lot of different things in addition to just the story in terms of how the story impacts us in our everyday lives.
Okay, did you hear that? Because see, this is really the goal. You know, when I say we're forming clearings, it is toward a kind of transparency that we're freed from this rigid, role-defined, you know, doctors cure but nurses care. I mean, what does that mean? And we hear that kind of thing over and over again. So all of a sudden, in 40 minutes, that you're able to say something or show something that transcends or goes under this role definition. And that becomes a place to start. Otherwise, efforts toward this so-called team work are simply fruitless. They're fruitless unless there is a fundamental opening up of, well, the doctor's going to be in charge if it's a cardiac arrest. Do you see? So this is an effort to get underneath that and to kind of jumpstart it's not like friendliness or intimacy or anything like that, but it's rather a rapid, direct means to express some interior thoughts, right, that matter for healthcare. So as you talked, was it about kind of illness-related things or?
It was more life in general.
Yes, yes. What happened in your dyad? Did you talk about life in general?
I'm shy. We did. Our stanzas went in different places.
Yes.
But it was all about mortality and acceptance.
Yes.
And my hope to find something positive to transcend that moment that she's in.
Yes. Yes. And we're not being summoned to the side of this woman in the car as internists or dentists or pediatricians or whatnot. We're summoned there.
And we're also that person also.
Well, we are.
Yeah, so we're seeing ourselves as that person as well. So it's
Yes.
not that's not an other, that's
Yes.
ourselves.
Yes. Yes. And that's the best explanation I've heard of why she may have written it in the third person. Because if it were I stayed in the car while my husband bought groceries, it would be easier for the reader to say, well, that's her. But to put it this way universalizes it to some way, right? Were your stanzas similar?
In a way, in the sense, my stanza said in a way that this was her moment. But those very healthy, prosperous people that she was looking to, their time is coming too.
Really?
So this is this.
You could do that in a stanza? Can we hear it?
I said. But then she understood that this is the destiny of all. It isn't bad. It's natural.
Yes. Yes. Yes.
So this was her moment.
Yes.
To learn something.
Yes. And in a way, you've gone underneath the suffering. In a way. That's not to take away that she can't button a button and she's probably nauseated most of her life. But it somehow goes underneath what feels like the random, unfair injustice.
Yes, yes.
Right? Just what you said. the destiny of all. Now, did it happen, it doesn't always happen, but did it happen that you surprised yourself by what you wrote? Tell us.
Something easy.
Huh?
My thoughts came out very easily because I thought she was a little morose, so I
Yes.
tried to uplift her.
Can we hear?
I said, time is valuable, make good use of it. Don't dwell on happy thoughts and memories rather than regrets or jealousy.
Okay. So this is so cool. Now, do you see? I'm going to ask an English teacher question. What's the genre of what we just heard? What's the form of writing here? It was an imperative, wasn't it? What was the first word? Take?
Well, time is valuable.
Time is valuable. Use it, see it, don't squander it. So it was like this almost, oh, I don't know, mother-daughter, some advice-giving, marvelous, flowed right out. Flowed right out. Yes, yes. We got to go, but you get the gist. It was better that I let you do it, right, than explain it? Thank you.